Good afternoon, ladies and gentlemen. It's an honor to have been invited to present to you this session today on patient education, capitalizing on the use of telemedicine technologies during the COVID-19 pandemic. My name is Waiel Bashari. I am a consultant endocrinologist in Cambridge University Hospital. My clinical work involves mainly looking after patients with tumors affecting various endocrine glands in the body. I have nothing to disclose. I do apologize for having to start with presenting to you some death data addressing mortality not related to COVID-19 during the initial phase of the COVID-19 pandemic. This graph shows a significant excess in the non-COVID death registration in England and Wales in the period between the months of March and May 2020. This unfortunate finding denotes the difficulties that healthcare sectors have faced and is still having to face during this pandemic, not only related to patients affected by this virus itself, but also including patients presenting with other conditions, having had to delay their presentation to hospital and or follow-up in hospitals due to challenges related to lockdown, etc. As a result of this phenomenon, the healthcare sector around the world have been pushed into the sudden future phenomenon, which amongst several other implementations involve the employment of telemedicine technologies and the application of distant virtual healthcare to fill the inevitable gap that have been unearthed in the medical practice. It is therefore prudent that the current generation patient should possess the ability to be able to adapt to such changes in order to benefit from the current methods used in delivery of care. I will now show you an example in the form of a clinical vignette of a patient who was assessed for a non-COVID yet still a significant health problem using telemedicine technology. This is a 20-year-old man who presented to his local doctor with progressive visual deterioration over a period of many months. Several causes have been implicated, and he received several forms of treatment without improvement. This summative grayscale graphic shows an imitation of his visual ability in both the left and the right eye, with the solid black areas denoting complete absence of vision. Understandably, this young man was drastically disabled as a result of his near complete blindness. He was assessed by our team in collaboration with his local team back in Khartoum in Sudan. Subsequently, we have confirmed that he has a large brain tumor affecting his pituitary gland, which is basically the main endocrine gland located at the center of the brain. Treatment of such complex tumors would require detailed discussion with the patient and a great deal of understanding of all the implications that are associated with offering any form of therapy. We managed to use all the technology available to hand in order to accurately deliver clinical consultation and patient education. This 3D rendered model is a product of this patient's different skull and brain imaging modalities, all fused together. Through teleconsultation, we have managed to communicate our information delivery and management plans with this patient with a reasonable outcome. We were able to share this and other imaging and graphic and written information with the patient whilst he was sitting at home browsing through his smartphone. Such, and with good understanding of all the possible outcomes, we managed to start him on a form of medical therapy with tablets taken twice per week in attempts to shrink this tumor. Few months down the line, his vision has started to improve, and a blood test for his tumor marker had dropped down significantly, as shown in this graph on the right hand side. As a result, his tumor has significantly shrunk with as seen as observed on the repeat magnetic resonance imaging on the right column here compared to the original scan, which is here on the left side. This slide shows an example of the written information leaflets that we crafted for this gentleman in particular to use as a guide. It provides room to increase patient empowerment in order to allow the patient to be thoroughly involved and well educated in their disease, which, needless to say, helps during the COVID-19 pandemic, where face-to-face consultations have been extremely limited. We have managed to publish this case as a case report showing the application of telemedicine technology in treating such complex tumors, which to our knowledge is the first telemedicine approach ever used in this disease category. This management outcome would not have been possible without the effective virtual patient education that we've implemented for this patient. As a result, we have now established a virtual service involving a variety of medical personnel to allow the delivery of such specialist service during the COVID-19 pandemic and beyond. Patient engagement and education represents a cornerstone in the success of such a consultation. This diagram starts with the encouragement to identify the correct patient for such service. We must acknowledge that the delivery of this technology may not be appropriate for a certain sector of patients. However, with more education, we can include more patients who may be able to benefit from such an approach in this new world with COVID-19 pandemic and further lockdown looming in the horizon. Thank you for listening.
So please remember, if we all help and do a little bit, it will make a big difference.